Jeremy, would you like to start by telling us what you do as head of your division and the broad area of work that you're in?
My name's Jeremy Hall. I'm a Professor of Psychiatry and Neuroscience here at Cardiff University, and I run a division in the university, quite a large division, where we look at major brain disorders from cradle to grave. So in young people, we're looking at things like autism, learning disability or ADHD. In slightly older age people, we're looking at the emergence of maybe depression or bipolar disorder or psychosis and schizophrenia. And then in old age, we study a range of dementias, including Alzheimer's disease, Huntington's disease, Parkinson's disease and related conditions.
That sounds a pretty complicated area. So how do you go about doing that?
Yeah, these major brain problems, major brain disorders have a huge burden in society. And at the moment, we don't have great ways of treating them, unfortunately. And that's partly because they are complicated. It's difficult to understand the brain. It's a fascinating but also very complicated organ. And so, unfortunately, our treatments for things like dementia or mental health problems like manic depression lag a long way behind where we are in many other areas of medicine. How do we overcome that? What we really need to do to make a shift forward is to understand the causes of these conditions. And we haven't had that level of understanding. But what's very exciting now, and what I'm very pleased to say my colleagues in Cardiff University have been right at the forefront of, is beginning to unravel the causes of these conditions. One area where we've been doing that is looking at the genetic causes of these disorders. We know that oftentimes, not always, but oftentimes they can run in families, and that suggests a genetic element. And that gives us a key way in to understanding what's going on. And Cardiff has been a world leader in the genetics of brain disorders.
And what are the difficulties involved in studying conditions that are not physical conditions? You know, there aren't physical symptoms necessarily that you can list and examine and say, okay, this is clearly a certain type of disorder. How do you do that?
It's a really fundamental question. And when I was training as a psychiatrist, we had no way of doing that, and we're only just beginning to now. So we could only really get at what was going on in somebody's brain by asking them questions, if you like, and that is a bit through a glass darkly. Whereas now we have the beginnings of being able to look more directly at what the underlying issues are. So part of the way we can do that is through, for example, advances in brain imaging, which enable us to look inside the brain, which is otherwise a very inaccessible organ. It's very difficult to take a biopsy from the brain. And so we need to have ways to look directly at what's going on in the brain, in life. And one of the best ways to do that is through advanced brain imaging. And there's no doubt that the brain imaging facilities that we have here in Cardiff are unparalleled.
Of course, if people view these disorders as clearly clinical, with clearly clinical causes that we can prove, it changes the attitude towards them, doesn't it?
Yes, I mean, mental health and to a degree dementia are still areas that are very stigmatized in our society, and that is very unfortunate. I think we will look back on this in the way that cancer used to be stigmatized in the past. And there's no doubt that the most effective way, in my mind, to change that is to understand, to unpack the mystery of these conditions and to show that they have rational, understandable causes, just like other medical conditions do.
And are there any, it's a very difficult question to answer actually, but are there any specific conditions that you feel that the lines of research we have are very promising and may well have a chance of affecting real change?
I think there are a few. It is really exciting. I could maybe give a couple of examples. One would be, I really do think that our work in immunology in relation to dementia is going to make a difference. I think that it's very likely that Alzheimer's disease is driven extensively by immune changes in the brain, and that it is possible to develop new treatments to target that. And, you know, I don't think any of us need reminding how urgently we need new treatments for Alzheimer's disease and the like. So I think that's a really very exciting area of research. I think if we look back, you know, at earlier in life, if you like, then you know, we've really made amazing advances in understanding the causes of very disabling conditions like schizophrenia. And they have shown us a range of new potential treatment targets. And we are able to work closely with our colleagues in the Medicine Discovery Institute on some very promising treatment targets there to take forward. Some of which are repurposed medicines, so we know they're already safe in the human population. And so I think that, you know, we will see much needed progress in the treatment of schizophrenia in the coming decades as well.
Let's imagine I come along to you and I have access to really significant resources and I want to put them somewhere that's going to make a real difference to mental health. Tell me why I, in that scenario, should support Cardiff.
We need to make a paradigm shift in the way we treat psychiatric and mental health problems. And I believe we can do that now and that we have the resources to do that here in Cardiff. To do that, we need to bring together our understanding of people's differences through their genetic makeup with our understanding of what goes on in the brain, the biology of the brain, if you like. And if we do bring those things together at scale, we can move towards what I would call precision psychiatry, where we can give the right person the right treatment at the right time, rather than the piecemeal approach that we have to take at the moment. And I believe we can do that. We can make that transition here in Cardiff.